Hey, welcome back. So we've talked about all kinds of skin diseases that can be caused by different microbial pathogens. Now let's talk about some diseases of the nervous system. This mainly is going to apply to the brain, to the spinal cord, and to other nerves. If we are talking about the inflammation of the meninges, this is what covers the brain and spine. It's called meningitis. If we're talking about an inflammation of the brain, it's called encephalitis. And if both are inflamed, it's meningoencephalitis. These can be caused by normal microbiota. So Haemophilus influenzae can cause meningitis, Neisseria meningititis, and Streptococcus pneumoniae. If it is caused by Streptococcus pneumoniae, it's called pneumococcal meningitis. It can be caused by invasive pathogens, something like listeriosis caused by Listeria monocytogenes. First, let's talk about polio or poliomyelitis. This is caused by the polio virus, which is an infection typically enters the fecal oral route. It caused paralysis in less than 1% of patients. It more commonly caused fever, sore throat, headache, and nausea. If respiratory muscles were paralyzed, that would impair a patient's ability to breathe, so that would lead to death. So this machine here is an iron lung, which was used to keep thousands of people alive. It used air pressure to force the lungs to move so that the patient could breathe while those lung muscles are paralyzed. This is something that they would have to live in for the rest of their life. They could come out of there for a few minutes a day, but they would be in this for the rest of their life. At this point, polio is vaccine preventable. We don't have a lot of cases in the United States. I think there are only a couple of people. If you want to know exact numbers when you're watching this, you'll probably have to look it up. But only 1 or 2 people that are still using an iron lung today. This primarily targeted adolescents and young adults, so it's called a childhood disease. And the virus would be able to get into the cytoplasm of nerve cells. And as the virus multiplied, the cells would die. And the death of those nerve cells is what caused the paralysis. Rabies, which is caused by Lyssa virus, is a zoonotic infection. It is caused by a bite from an animal that has been infected. The virus then can replicate near the bite and will start destroying cells. And one thing that's important here is a bite that doesn't break the skin can still cause infection. It can replicate in the epithelial cells and still travel to the peripheral nervous system. And then from the peripheral nervous system, it can invade the central nervous system and lead to madness. So symptoms like mania, insomnia, paranoia, hallucinations, and hypersalivation. Once it invades the central nervous system, it will develop into a fatal encephalitis. Death will occur within days. In the whole history of the world, people surviving rabies without a vaccine is almost impossible. There have been something like 6 people in the entire history of the world that have survived a rabies infection without a vaccine treatment. So rabies, I would far and away put this as the most fatal virus that there is in this country, in this world. There is a vaccine for it. So if someone is infected, if there's a chance that they have been infected with rabies, go and get that vaccine immediately, because it does take a while for the virus to travel from your skin to your peripheral nervous system to your central nervous system. So you can go get that vaccine immediately. I know in my house, we had a bat got into the house one night. It was in my children's bedroom. And my daughter came downstairs and said there was something making a sound in their room. And it was a bat that we caught. And so we took it to the health department and had it tested to make sure that that bat wasn't carrying rabies. Because if there is a rabid bat, we would have had to vaccinate the kids for that. So that's my own little story about rabies. Let's see. Then a fungal infection is cryptococcosis, caused by the fungus Cryptococcus, either C. neoformans or C. grubii. These are spores. They produce spores that can live in the soil. And then if those spores are inhaled, it can infect the central nervous system and lead to meningitis, although this mainly only affects immunocompromised people. And then some bacterial infections we talked about already. I think you're probably comfortable with these already. Tetanus caused by Clostridium tetani, botulism caused by Clostridium botulinum, and leprosy caused by Mycobacterium leprae. Then some protozoan diseases. African sleeping sickness is one that we talked about already when we discussed antigenic variation. So this protozoan, Trypanosoma brucei, is capable of undergoing antigenic variation for years. It is carried by the tsetse fly, so a bite of the tsetse fly can result in an infection. Currently, there are about 500,000 Africans infected with this. Then amoebic meningoencephalitis. So this is one of those infections that I think of when I watch shows like House or Grey's Anatomy, those medical shows that like to dramatize it, because this is a very fatal type of amoeba, but it's also very rare. So the amoeba Naegleria fowleri, if it is typically it's associated with warm water, so you'll inhale it, it'll get into your nose and then travel to your brain, where it is going to destroy your brain and cause amoebic meningoencephalitis. I think in our area a few years ago, there was a case of a dog swimming in one of the lakes or rivers around our area that developed this infection, but I don't remember any people having an infection with that when that happened. Then prions. We've talked about prions a little bit already. Creutzfeldt-Jakob disease is a spongiform encephalopathy. So you can see this on the right is a normal healthy brain, and on the left is a prion-infected brain. It's not nice and full and firm and big and healthy looking. It is a wasting away brain. So, and prion diseases can be inherited. So if someone has a bad gene that creates that misfolded prion, it can be passed on to their children. It can be ingested from eating infected beef or something, and it can be transplanted. Mad cow disease would be a prion disease that infects cattle. And then Kuru, which will cause the body to laugh, as they don't have good brain control, they lose the ability to control that. So they'll have bursts of laughter. So it's sometimes called laughing sickness. That word Kuru means shaking because it also causes body tremors. This is associated with cannibalistic tribes. I remember one time watching a show where, it was one of those dramatic shows, and they were trying to figure out the outbreak, and they figured out it was cannibals, this, crazy group of people living in the, outback somewhere that were cannibalizing each other and passing on this Kuru to each other. So that is something to keep in mind. Hopefully you don't have a patient like that. And then I will meet you back in our next video. That is an odd disease to end on, but that is where we're finishing this one for today. So if you have any questions, please let me know. And I'll talk to you later. Bye, class.